Personal health information. PHI is an acronym for Personal Health Information or Protected Health Information and refers to any medical record, which can be used in identifying a person and was created, recycled or revealed when providing healthcare services such as treatment or diagnosis. PHI can also refer to information that is personally identifiable in medical records comprising of discussions between nurses and doctors concerning treatment. Besides this, it includes the billing information or health insurance of a patient, according to the definition by Health Insurance Portability and Accountability Act (HIPAA). Personal health information defines the type of information from a patient that falls within the authority of the law. There are two vital things to consider before health data is considered and controlled by HIPAA as PHI. The patient can personally recognize it and disclosed or used to a protected entity in the development of the treatment. Following are some of the examples of public health information. Billing data from your doctor. Phone records. Results of blood test. Email between you and your doctor regarding prescription or medication needed. MRI scans. Appointment schedules note with your doctor at his office. An MRI scan. Blood test results. Phone records. The following are health data, which is considered as not part of public health information. Number of calories you have burned. Number of stages in a pedometer. Your blood sugar readings without personally recognizable user information. Your heart rate readings without information that can be personally identified. Difference between public and consumer health information. In determining if OnRequest collects PHI for developers or it is not critical in determining if HIPAA compliance has to fulfilled or not. In this case, what is the next step in dealing with consumer health information or PHI? The experiment is quite easy and straightforward. If an application or device that you are building records or transmitting the health data in the device or app and discovered, if you are collecting the health information without the intention of sharing, then you do not have to be HIPAA compliant. There are three vital concepts, which are interchangeably used when discussing about the protection of public health information. These concepts are security, confidentiality, and privacy. Security refers to the protection of information, confidential refers to the obligations of professionals, and privacy refers to the right of the patient. What is EPI? This is an acronym for Electronic Public Health Information and comprises of all health information that is identifiable to the individual, which is created, conserved, or distributed by electronic means through mHealth and eHealth products. It comprises of the web, desktop, wearable, mobile and other technology including text messages, email etc. Protected health information and the consideration for developers. Perhaps you are assembling an application to deal with health data. You might be considering if the particular sort of information needed will be regarded as PHI or not. There is a way to know. One key consideration between PHI and application developers is the edges where participants can add PHI-related information to such application via their continuous usage, even if such application wasn't meant for such purpose. Nevertheless, if what you are designing collects public health information, even if it was by design or not, it still has to be in compliant with HIPAA standards. This covers anyone who delivers payment, treatment, and procedures in healthcare. According to the United States Department of Health and Human Services (HHS), health plans, healthcare providers, and healthcare clearinghouses are all covered in the entity. Healthcare providers include doctors, hospitals, dentists, pharmacies, nursing homes, dentists, psychologists, and chiropractors. All these require HIPAA compliant. Health plans include Medicare, health insurance companies, Medicaid, company health plans, and HMOs. Additionally, schools and employers that handle personal health information in order to enroll their students and employees in health fall within the boundary of a health plan and need to be HIPAA compliant. Definition of a business associate under HIPAA. Business associate BA is a subcontractor or vendor of a covered entity and who has access to PHI. Under the law of HIPAA, BA is any entity responsible for the use or disclosing of PHI on behalf of a covered entity. When a BA assigns a covered activity or function to someone, then such person is a subcontractor. Vendors like a plague avoid some PHI. It is important to note that the refusal of signing a business associate agreement does not clear you from the provisions of HIPAA compliance in case you are responsible for handling PHI in any way. Video.